limited access to primary care and specialty services, and we saw increases in death rates from heart disease and diabetes and other chronic illnesses.
It's just so striking to see this standard benchmark metric going down in a country as wealthy and prosperous as we are. And as you're saying, we are unique compared to other similar nations. Why is that?
Well, it's not because we don't spend enough on healthcare. We are unique from other countries also in the massive amount of money we spend on healthcare, much higher than other countries, and much higher than countries in which people live longer lives and are healthier. So this is a lesson for us that healthcare is only a partial answer. Its studies suggest it only accounts for about 10 to 20% of health outcomes. Our health is really shaped by our living conditions, jobs, the wages we earn, our wealth accumulation, the education that enables us to get those jobs. And we're struggling in those areas. And it's because of that struggle that we're seeing our health suffer as a result.
You're describing then potential remedies to arrest this decline are fundamental structural changes to American society. It's not just vaccines to avoid COVID deaths or naloxone to avoid overdose deaths. You're talking about something much more systemic.
If this had only happened during the pandemic, we could blame it on a virus. But the fact that it's been going on for so many years tells us that we as a society have to make a decision. We have to shift our priorities if we want to be healthier and we want our children to not die prematurely. The the country that we live in is the richest in the world, but we have the highest level of income inequality. So much of the resources that we need for a healthy population are not available to most of the population.
All right, Dr. Stephen Woolf, Director Emeritus at the Center on Society and Health at Virginia Commonwealth University. Always good to see you. Thank you.
Likewise, and thanks for giving attention to this important issue.
In the day's other news, a massive winter storm is tightening its grip on a huge swath of the country and threatening to upend holiday travel plans for many Americans. Flight Aware, an app which tracks the flight status of airlines, reported more than 2,200 flight cancellations in the U.S. today. Robbie Chavez has the latest.
On one of the busiest travel days of the year, people across the country are finding themselves in the same position, trapped where they started.
Tired, stressed, hungry, just hopeless, honestly.
The National Weather Service reporting that 190 million Americans are under some type of winter weather advisory, spanning a vast part of the country from the plains and Midwest to the East Coast. The blizzard-like conditions do not bode well for thousands trying to make it home for the holidays, creating even more chaos at overwhelmed airports with thousands of cancellations. Some travelers are deciding to take matters into their own hands and skip the airport where they can.
We're trying to search on our phones, figure out other routes, maybe even taking a bus from here to Atlanta, which it'll take us about 21 hours, so that's really inconvenient, but anything we can do just to get there, what we're going to do.
We've been monitoring the travel concerns for the past couple days since we heard the blizzard is going to Minneapolis, where we're heading. And hoping we make it there on time and safely, and once we get there, we're hoping we can drive safely to our destination. It's just a little hectic right now. We're not exactly sure.
But in the Midwest in particular, road conditions are also posing a challenge. Roadways in Nebraska and Iowa are slick and blanketed in snow. And in South Dakota, this video from a local sheriff's office captured a bottleneck of over 100 cars on Interstate 90 late yesterday. Stranded motorists were rescued and taken to emergency shelters. With the worst